Aloha everyone, Dr. Summer Nicole here. I just got back from 3 weeks of travel, and I was in a Kundalini yoga therapy training, and then I was also in this craniosacral therapy class called Unwinding the Meridians, or Applying Acupuncture Principles to Craniosacral Therapy. And some of you know my background is Western science. My doctorate's in physical therapy, and physical therapy is such a biomechanical approach. I was super grateful to have found craniosacral therapy, and after going through this most recent training, I have just these incredible insights on how I can approach healing and how the body can actually participate in healing. And so two paradigms with craniosacral therapy. The first is that the body is always working toward healing, and hi Bram and Carrie, love you. And the second is every person's system knows exactly what it needs to heal. And so I've known this for a while, having been a craniosacral therapist for many years now. And so with this recent training, this applying acupuncture principles to craniosacral therapy, I was studying with this teacher of 20 years, and he reinforced this idea to me that we were taught in earlier cranial classes, but I didn't apply it to this degree, that you can use the craniosacral rhythm, which the craniosacral rhythm is the movement of the cerebrospinal fluid that surrounds the brain and the spinal cord, and that's your central nervous system. And so in craniosacral therapy, they use this movement of the cranial rhythm, they call it, to get answers. And so they even call it like you can ask the body any questions, and the body will give you have to ask yes or no questions, and the body will either shut down or the cranial rhythm stops for a moment, and then you can ask another question, and if it's a no, it can go back on. And so you have to decide with each person what their yes is and what their no is. So it's so fascinating. So at the beginning of the session with each client, he was teaching us to ask, okay, think about a loved one, and I'm feeling for the cranial rhythm, and I get this kind of stop in the cranial rhythm, and they call that in cranial significance detector, so meaning it's significant. And I say, okay, let that go. Now think of drinking something terrible like motor oil, and then I did that. And then the cranial rhythm keeps going. So that's their no. So their yes is when the cranial rhythm stops. Their no is when the cranial rhythm keeps going. And so then I can proceed to keep asking the body questions. And, do they need meridian balancing? Do they need craniosacral therapy? Do they need somato-emotional release? Do they need, manual therapy? Do they need deep fascial work? All the things that I particularly do. So I can ask. And then, and you can get super specific. So if say they need meridian balancing, I can be feeling the cranial rhythm, and then be going through, okay, does their lung meridian need balancing? Their large intestine, stomach, spleen, liver, gallbladder, go down the list to find out which meridian needs balancing. And this was just so fascinating to me, because it just super drove home the point that, and I talk about this all the time in yoga and with my patients with therapy, is that our body has this inner wisdom and this innate intelligence, and we all know that, but it's like to actually communicate. This to me was like communicating with that innate intelligence, and that innate intelligence being the movement or the rhythm of the craniosacral rhythm, or the movement of the cerebrospinal fluid that surrounds the spinal cord, that surrounds the brain, that surrounds our central nervous system. So if you think about that for a second, just like that life force energy that's living and breathing our body, and that's making our brain work and our heartbeat and our breath go, it's like really communicating with that source. And it just floored me, because I've always worked very intuitively with people. I can read energy very well, and I kind of know where to go with people. But this is like different. This is like taking me, the therapist, or any therapist, completely out of the picture, and and literally just putting you know, hands on somebody and then just asking that person, they're asking that person's cranial rhythm, yes or no questions. Is this physical? Is it emotional? Is it energetic? Is it spiritual? Is it psychic? You know, going down just this sort of menu, they call it, of lists. And I know a lot of therapists that work like this, and I haven't ever really, I don't think I've really understood it to this level. And so for the last few weeks, I've just been applying this and really asking the body exactly what it needs. And it's so fascinating, because if you think about it, what we think we need, what our mind thinks we need, is often not what we need. And so many people come to me with, you know, physical ailments and injuries, and they think that it's physical, and they think that it's because of something that they did to their physical body, but really, like, going through a process of showing someone that, okay, no, the body is actually saying, like, this is emotional, okay, and then going through, when did this happen, and literally going through that this happened conception to birth, listening for the yes or no, that this happened 0 to 10, 10 to 20, 20 to 30 years old, all the way, you know, up, and then asking who it happened with and where it happened. And you see where I'm going, just getting super specific on exactly where things came from in the body. And this is just like a huge insight for me in treating clients, and I love it, because it just completely takes me out of the picture, and then just all I'm doing is communicating with the body, and then using whatever the body's telling me. If it gives me a yes or it gives me no, depending on the cranial rhythm, giving whatever answer it gives to me, that's exactly what I do in that session. And so I just wanted to share this, because I wanted you to know, you know, a lot of people that either aren't in the therapy world or not in the healing world, and you just go see different practitioners, you know, I want you to know that there are practitioners, like, out there that can really truly communicate with your body's innate intelligence, and use the treatment according to what your body actually needs, not what your mind is telling you that you need, but what your body actually needs. And so, and what's fascinating is, you know, I can even do this work from a distance. I can do this work, you know, even off the body. We're taught to feel the cranial rhythm, which is really fascinating. And so anyways, I wanted to share this and just get it out there, because I'm taking new clients, and for distant healings as well, and super fascinating work. So I really hope that this inspires you, that your body's never ever stuck in any particular, you know, pain pattern. Your mind might think that it might be, but your body is always working toward healing. So just know that your body's always working toward healing, and that your body actually has this innate intelligence in it that knows what you need to heal. And you know, if you can't get to that, you know, answer, that there are people out there, you know, that there are therapists out there, and people that do healing work out there that can communicate with your body and your system and your body's innate intelligence to communicate with you exactly what you need. And so let me know if you have any questions, or if I can support you in any way. And I just felt really floored to share these new insights. So hope this helps you. Aloha.